Hello, I'm Dr. Soran Hassan Zangana. I'm a specialist of internal medicine. In this fifth video of the series about diabetes mellitus diseases, I'm going to talk about the complications of type 1 and type 2 diabetes. The first, we need to know that these complications occur, the incidence of them increases with time. That means a patient who has been diagnosed for the last 10 years has more chance of developing complication than the one who has been diagnosed 1 year ago. The other thing, the more controlled the blood sugar, the less chance of these complications to occur, and the less controlled blood sugar, the higher chance of getting these complications. From these complications are complications related to the heart and the arteries or the cardiovascular system, including affecting the arteries, causing atherosclerosis, thickening of the arteries, also leading to coronary artery disease, leading to angina and even heart attacks. Also, diabetes mellitus, if has been there for a long time or if uncontrolled, can increase the chance of developing stroke. The other complications is the effect of diabetes over the kidneys may lead to the kidneys not to work properly and developing chronic kidney disease. If it was not controlled and the diabetes was not controlled, this might lead to renal failure and eventually leading the patient to need dialysis or kidney transplantation. The other damage is damage to the nerves. If this damage occurs to the peripheral nerves, this is due to the diabetes affecting the vessels, the capillaries that supply these nerves with nutrients and oxygen. When this occurs, the patient might feel numbness, a feeling of hotness in the feet, and sometimes pain or tingling sensation that's mainly in the flat side of the foot or even the toes. With time, if it was not controlled and the blood sugar was not controlled, it might extend to the rest of the feet and upward through the leg. If this damage affected the autonomic nerves, it might lead to problems with digestion. The patient might feel nausea, vomiting, diarrhea, constipation because of improper working or improper movements in the stomach and the intestines. In men, the damage to the nerves can cause problems with erection and erectile dysfunction. Because of the problem in the peripheral nerves, and also because the people with diabetes have less proper blood flow to the legs because of atherosclerosis and peripheral arterial disease, they might have complications, especially in the feet, because they might not feel when they put their feet on a hot object or on a sharp object, leading to become like a wound, and this wound might get infected if it was not controlled, the blood sugar was not controlled. This infection might progress to gangrene and eventually make the doctors no other choice about amputating that part of the foot or the feet or the leg. Another complication is when the diabetes affects the blood supply for the capillaries that supply the retina of the eyes, leading to what's called retinopathy. If it was not detected early and it was not controlled, this might lead eventually to blindness. Also, diabetes increases the risk of glaucoma and cataract more than the other people who do not have diabetes. Also, those who have diabetes have higher risk of getting skin, bacterial and fungal infections, have higher chance of developing hearing problems, have higher chance of developing Alzheimer's disease and other forms of dementia, and also have higher chance of developing depression. And once diabetic patients develop depression, this will affect their management. At the end, I would like to encourage any diabetic patient who's seeing this video to please be confined to your diet, do your exercise, take your medications, visit your doctor regularly as it has been planned by your doctor. If you have any questions, you can write them in the comments and I will answer it as much as possible through the comments or maybe in the upcoming videos. If you like the video, please share it with other people and be safe.